My favorite motto is basically, if you weren't born with it, then it has the potential to heal and reverse. And that's what I've seen. Literally, when I went into functional medicine or root cause medicine, within a couple of months, I was seeing medical diseases and chronic issues reversing that previously I would have said, I'm sorry, you have to manage this for life. And these were things that literally were disappearing.
Welcome to Season of Stuck, the podcast that takes a deep dive into the all too human experience of feeling stuck. I'm your host, Deanna deBara, and on this podcast, we explore all things stuck. How and why stuckness happens, what it feels like, how to learn and grow from it, and ultimately, how to get unstuck and move forward in an authentic, empowered way. If you are looking for insights, support, and community as you make your journey from stuck to unstuck, you're in the right place. Just a heads up that today's episode dives into some health topics. So just a reminder that Season of Stuck is for general information only and should not be considered health, medical, or any other type of professional advice. For more information, you can check out the disclaimer in our show notes. Okay, now on to the show. Hello there. Welcome to another episode of Season of Stuck. I am your host, Deanna. And can I just say that I am so happy that you're here and I so appreciate you listening. So thank you for tuning in. Today, we are going to dive into an area where I have for a long time and in many, many ways felt stuck, and that is health. So to give you a bit of backstory, I have not one, but two autoimmune diseases. Basically, my immune system is just super overzealous and confused. Instead of just fighting off things like viruses and germs and bad bacteria like it was designed to do, my immune system also attacks my body. I have Hashimoto's, which is an immune disease that affects the thyroid, and also rheumatoid arthritis, or RA, which impacts the joints. And I'm going to be honest, even though it's very uncomfortable for me to admit this, living with these conditions can be really, really hard. When my thyroid is out of whack, I get intense fatigue, and it doesn't matter how much I sleep or rest, the exhaustion just doesn't go away. I also get brain fog, which makes it really hard to focus or even remember what I'm doing in any given moment. And it can also ramp up my anxiety or go in the other direction and ramp down into depression. And when I'm having an RA flare, I'm just in a lot of pain. My joints hurt, I feel stiff, it's hard to move around. Yeah, it can be rough. And there are just so many different flavors of stuck associated with this for me. For sure, my symptoms can make me feel stuck. For example, I live less than an hour away from an epic mountain, but I haven't been snowboarding for the past 2 seasons. My feet are the first place where I feel my RA when it flares up. And these past few years, it's just been too painful to put on snowboarding boots, which has been a major bummer. There's also an emotional stuckness associated with my autoimmune diseases. There are so many different emotions that come up for me with this. When I don't feel good, I get stuck in shame spirals and can beat myself up about what I'm not able to do or accomplish or how I'm not able to show up. I feel guilt if and when my autoimmune issues prevent me from showing up for other people, like if I'm having a lot of pain and need to cancel plans or need to push a deadline for one of my clients. And I also get very, very self-conscious talking about it. I don't want to come across as someone who just wants to complain or focus on the negative or is unable or unwilling to take the steps necessary to take care of themselves. And so a lot of the time, I just don't talk about it at all. Even though I know that the only person thinking those things is me, and I would never, ever think that about someone else for talking about their struggles, when it comes to me, it just feels really hard. And I can feel really, really stuck when I think about what these conditions mean over the long term. Autoimmunity has, for a long time, felt like a big question mark. Most doctors say that we don't really know what causes it and we don't really know how to heal it. So the best thing that you can do is manage the symptoms, which generally means taking medication, which I do, many different types, many times a day. And don't get me wrong, I am so grateful for modern medicine and the fact that there are medications that, for the most part, keep me functioning in a normal way. It has taken a lot of ongoing maintenance and trial and error, but at the moment, both my Hashimoto's and my RA are pretty well controlled with meds. And that is such an incredible feeling. But I felt frustrated, stuck even, by the thought that while I can take medication to keep my symptoms under control, there's nothing that I can do about the actual core issue, which is that my body, for some reason, likes to attack itself. But this idea that autoimmunity is a big question mark and there is no way to heal it is an idea that is being challenged. There is an entire medical movement that is focused on not just treating the symptoms of chronic disease, but treating the actual root cause. That movement is called root cause or functional medicine, and it takes a more holistic approach to treating disease. Instead of focusing on the symptoms, when you work with a functional medicine doctor, the goal is to really dig into what is causing those symptoms and then create a personalized, tailored plan for treating that root cause. And it's not just autoimmunity that this branch of medicine focuses on. Type 2 diabetes, anxiety, depression, digestive disorders, chronic fatigue. Functional medicine can be applied to all sorts of chronic conditions. And while every condition and every patient is different, there's one part of the body that often plays a major role in these chronic health problems, and that is the gut. Now, full disclosure, I had absolutely no idea that the gut played such a big part in overall health. And while I had read some articles about the connection between autoimmunity and gut health, I never really explored it too deeply. That is, until I talked to today's guest. Dr. Markyia Nichols, MD, is the Chief Medical Officer of Ciba Health, a digital precision health and integrated care platform that aims to prevent and reverse common, complex, and costly diseases by blending advanced lab testing, physician-led care teams, cutting-edge technology, and ongoing in-depth nutrition and lifestyle support to get to the root of chronic conditions and help patients heal. In our conversation, Dr. Nichols and I covered so much ground. We talk about the connection between gut health and overall health, including mental health, some of the most common gut issues people struggle with, and how those issues can make you feel stuck, and how root cause medicine can help you identify what is going on in your gut and your health and make the changes needed to heal your gut and get unstuck in the process. Dr. Nichols had so many incredible insights. This conversation was a pretty mind-blowing one for me and really shifted my perspective on how I think about my autoimmune issues and what I might be able to do to change them. So I'm just really excited for you to hear it. Let's jump into my conversation with Dr. Nichols. Dr. Nichols, welcome to Season of Stuck. Thank you so much for being here.
Thank you for inviting me. I'm really looking forward to the conversation.
I am really looking forward to this conversation. I feel like there has been much more of a conversation in the health space about the gut and the role that the gut plays in overall health. But in many ways, it still feels like a mystery to me. And I know to a lot of other people. So I'm so excited to kind of deconstruct that mystery and get a little bit of a deeper understanding.
Awesome. Yes, let's chat about that.
Yeah. I guess to kick things off, I would love if you could introduce yourself to the listeners. What inspired you to get into functional medicine? And tell us a little bit about your company, Ciba Health.
Sure. So I have been practicing now for about 20 years. I started out in traditional medicine, so I was OBGYN, and I loved OBGYN. I loved my mamas, my babies, running around. It was very fast paced. It was quite stressful, but at the same time, there was high reward in that. And there was very early in my career, I started noticing a pattern that was uncomfortable for me. So I would basically have women who would come in. Women always knew that there was something going on with them. And they would literally sit in front of me and say, Dr. Nichols, I think I have a thyroid issue, or I think this is going on. And of course, I would run the labs, and all the labs would come back, quote, quote, normal. And it was so frustrating to sit in front of those women and literally have that lab sheet and say, but everything is normal. And I had very limited tools in my toolbox. And I noticed every year they would come back, I basically would give them another pill, and the situation would never get better. And this continued until I became the patient. And basically, I did the same thing. I checked my labs. I had a colleague take a look at them. Everything looked normal, but I knew I did not feel normal. And for the first time, I thought, oh my gosh, this is what my patients are feeling. And I almost retired from medicine. And serendipity ended up kind of showing me a path to a conference where they were really looking at some holistic ways of looking at the body and looking at disease. And a lovely angel there introduced me to functional medicine. And I went that route and I literally fell in love with medicine again. So for the last 15 years, I have been fully entrenched in this. My favorite motto is basically if you weren't born with it, then it has the potential to heal and reverse. And that's what I've seen. Literally, when I went into functional medicine or root cause medicine, within a couple of months, I was seeing medical diseases and chronic issues reversing that previously I would have said, I'm sorry, you have to manage this for life. And these were things that literally were disappearing. And it's quite simple, actually. It's medicine that we learn in medical school. It's getting down to the biochemistry, like what's actually happening in the cells. But unfortunately, when we get out into our residency practice, the biochemistry goes out of the window and you're literally taught this is the disease. Let's figure out how to diagnose it. And here's the drug to treat it. So this is getting back to basics. And I am like really excited to chat with you about this because in many ways, we can control each individual person can really take responsibility for moving forward, prevention of health and really helping to get on top of some of the struggles and some of the chronic diseases that we might suffer with.
I feel like you are speaking directly to my heart and telling my story. I have 2 autoimmune diseases, including Hashimoto's, which is an autoimmune disease of the thyroid. And when I first realized that something was wrong, I went to multiple doctors over the course of years and said, something is wrong. I don't feel right. My hair is falling out. I'm exhausted. And they would pull up that sheet and say, well, your TSH looks normal, so everything is fine. And I had to advocate and fight for myself to get additional testing, which then revealed, oh, yes, you have so many thyroid antibodies. This is absolutely Hashimoto's. Let's get you into treatment. And following that, I was told that the only treatment is medication for both of my autoimmune issues. Every doctor that I've seen, and I've been lucky to see some really great doctors, MDs, but their insights are, well, this is now what you have. We can't tell you why you have it. And all we can do is treat the symptoms and get you feeling as good as you possibly can feel, which is really disempowering, right? It feels like there's nothing that I can do to control my health. And then there's fears about what that means in the future. Will this progress? So it is just, yeah, when you were talking, I was like, wait, what? There is something I can do. Like there are ways to reverse this and to stop my body from attacking itself, and it's through the gut. Like that just feels like such revolutionary information. So I'm just so excited.
Yeah, and you bring up a couple of good points because I think first off, the fact that you were empowered to continue that journey and to find answers. And it's interesting in this field, I think that really the forward momentum has come from people like me and people like you who are suffering from a chronic issue or a disease or just not feeling well and not getting the answers. And I applaud you for not staying stuck in that spot and taking that answer, oh, we can't do anything, and really pushing forward. And, I like to say, the body is very wise. So the body never attacks itself or knowingly, attacks itself. And that's where it's really getting to what exactly is happening at the root that the body is triggering. This immune reaction is getting triggered. And I think we're going to talk deeper about this and really looking at the gut and looking at some other things. But it is, unfortunately, I just have to kind of shake my head at some of the traditional doctors. They've just forgotten and they haven't been trained to look deeper into those labs. Looking at just the TSH, maybe a free T4 for someone's thyroid issue it's minimal. It's almost, it's just not standard of care even anymore. You have to expand, but you also have to know how to dig into those labs and really interpret what it's saying and then figure out, once you get to the root cause, there's always a root cause. For every person, it could be a combination of 3 to 5 to 10 root causes. But that's step one, really, in tackling and reversing any chronic disease. If you weren't born with it, then it's only lifestyle and experience and time that has created the situation that's enabled that disease to manifest. And we can, once you get to the root cause, you can tackle that and really start to get reversal happening.
I love the empowering message. And there's something that you said there that really stuck with me, which is that the body is wise. And we know when something is going on. And what's interesting is that it's a gut feeling. It's a gut feeling that something is wrong. So it's interesting how it all ties back to the gut. And I'm excited to jump into this. So
Totally.
I know this is a broad question, but can you tell me a little bit more about the gut and the role that it plays in overall health?
It's everything. I would say it's probably one of the most important and one of the first places that I look with any issue. It doesn't matter. You can name the disease, and that's the first place you're going to look. And there's a couple reasons for that. First off, we have a very important immune system. The majority of our immune system is housed in the gut. This makes sense. We're putting foreign material into our mouths every day. This is the part of our bodies that's really exposed, besides our skin, to anything that comes into our bodies. So we have a very robust immune system in our guts. And in addition to that, you may or may not have heard, but we have a second brain there. And in fact, it's called the enteric nervous system. There are more neurons in our gut than there are in our brains. And it's intimately connected. There's a bidirectional flow of information through our vagus nerve. So what is happening in the gut is also going to be reflected in how we feel, how our emotions are, our mental capacity, and vice versa. There, you can't disconnect the two. And the things that we put into our bodies, and we can get into that a little bit more, how that really impacts what is happening in the gut and how we're feeling.
Talking to your point about the gut being like a second brain, I have read that a significant amount of serotonin is produced in the gut, which then influences your mood and depression and kind of all things emotional.
Yeah. So going deeper with that, actually over 90% of our serotonin
Wow,
is
90%?
yeah.
That's huge.
And not only that, we're finding that there's certain bacteria, and I'll get into this deeper, and you can rein me back in if I go too far out. But everything that's happening in the gut in terms of our nervous system and our brain is really facilitated by all of the good gut bacteria that are housed there. So we have more foreign bacteria actually in our body, housed in our gut, than cells in our body. And they are responsible for creating our neurotransmitters, for creating peptides that help with satiety, like GLP-1s. We've probably heard of those. Our feel-good hormones, so dopamine as well as GABA. We're finding there are probiotic strains of bacteria that are specifically creating our relaxation hormone of GABA. So if we do not have good gut bacteria, or if we're housing a lot of bad bugs, I'll say, and that could be bad bacteria, it could be yeast, it could be fungus, it could be parasites. You'd be surprised how many people have parasites. All of them are going to actually create inflammatory stuff. So cytokines, they're going to create immune triggers that basically are going to not only attack our guts, but that gets translated to our brains. If you have inflammation in your gut, your brain is also inflamed. So yes, to your question, the majority of our neurotransmitters are created in your gut. So if you do not have those good bugs that are creating that, or if you have a base of inflammation, or if you're doing all the right things, but you're stressed out, all of these things are going to contribute to your gut not being healthy. And that in turn creates a situation where your brain is not going to be healthy or not going to feel healthy.
That's so interesting because I feel like that is the antithesis of everything I've always understood about mental health, which is that mental health resides in the brain. So it's so interesting to hear that, to the example of serotonin, that 90% of the serotonin in our body is produced in the gut. Like, that's so significant to understand that connection. So this podcast is about stuckness. And from what you said, it sounds like the gut plays an indispensable role in maintaining good health. But I know that a lot of people also struggle with gut health. So if a person has poor gut health, and like you said, bad bacteria, parasites, yeast, fungus, how can that contribute to them feeling stuck?
Yeah, and the interesting part about that too is that some people may not know that it's a gut issue. So the obvious symptoms, if we have, bloating or constipation, diarrhea, those things, that patient may go to their physician and say, I'm dealing with this issue, or I'm struggling with the gut issue. The problem is that most chronic disease actually originates in the gut. So sometimes the only symptom is actually anxiety for someone, or the only symptom may be depression or OCD, or it might be acne as a symptom. So this is why I feel like you have to start with the gut. It's usually at the top list of culprits as far as what might be contributing to feeling stuck. I'll also say too, it kind of there's a circular sort of feedback loop, because if you do have a digestive issue or you have diarrhea or constipation, a lot of times those patients tend to feel stuck in the sense of having more social isolation as well. They may not want to go to parties, or, they kind of suffer in silence. There's a lot more work absenteeism and things like that.
So it sounds like gut related symptoms can cause stuckness by creating an environment that makes it really hard to participate in life, right? If you are in pain, if you're bloated, if you're having like challenging like diarrhea or constipation or whatever the case may be, you're not going to really want to put yourself out there because you don't feel good and because maybe you're embarrassed or you would feel uncomfortable in certain social situations. And then the other element is that having poor gut health, even if you don't have gut related symptoms, can make you feel stuck because it can have such a devastating impact on your health, both physical and mental, that then prevents you from moving forward, whether you are stuck in anxiety or stuck in OCD and intrusive thoughts, or stuck in depression, or stuck in autoimmune issues where you're fatigued and you have brain fog and it's hard to focus. Like, all of those things can keep you stuck, and they originate from the gut, even if you don't consciously associate the symptom with your gut health.
Absolutely. And I think that's why having podcasts like this is really important. So it creates an awareness that you might be feeling a certain way and not really pinpointing that it's a certain body system, or that it's a gut, or that it could be one food that you potentially are eating. I've seen that a lot with autoimmune gut diseases like Crohn's disease. So you need an awareness for sure. And I think just being stuck in general, I look at it as, if you're feeling stuck and you have the awareness that something is off, it's almost just, it's a signal that something needs to change. And so, if you're able to take that first step, or if it's asking a friend, or even if it's sometimes going to a bad practitioner can create more stuckness. But like yourself, if you're feeling empowered, something is off, continuing that journey to find the answers, whether it's reading, not necessarily going on social media, but if you're being wise about following those who are really aligned with the type of solutions that you're looking for, then those things can help. And then ultimately, I would say, it's test, don't guess, but that involves really getting in with the right practitioner who is very expert at figuring out what the root causes are, and who are looking at, for each individual person, looking at the person as a whole as well, not taking 10 minutes to figure out what pill needs to go onto the symptom, but knowing that every part of the body is connected. So your brain is connected to your gut, is connected to your heart, is connected to everything else. No one is a set of specific organs that needs a pill to take care of each symptom. For every person, it doesn't matter how many issues, how many autoimmune diagnoses you have, how many different things, you are one person. And I guarantee for all of that, the root cause is contributing to everything. So once you get to, it's the beauty of root cause medicine. Once you find out for a patient what the 2 or 3 or 5 root causes are, and you start to address those and plug in the nutritional gaps, start to heal the gut. Well, we can talk a little bit about stress because that's kind of overlaying it all. You notice that not just one diagnosis is reversed and healed, but everything that you're dealing with also heals.
There are so many different ways to go from stuck to unstuck. But one of the most productive, learning. Learning something new can help you expand your skill set and find new interest, and in the process, help you get unstuck. And if you want to learn something new, you will definitely want to check out Skillshare. Skillshare is an online learning community that offers thousands of classes designed to help you learn, grow, and tap into your creativity, all of which can help you make the journey from stuck to unstuck. And right now, Skillshare is offering a free month to new members. If you want to access Skillshare's entire library of classes and get the education and instruction you need to shake off the stuckness, just visit seasonofstuck.com/Skillshare and sign up for your free trial today. Again, that's seasonofstuck.com/Skillshare. We've touched on a few of them, but you keep coming back to this root cause in the gut that is driving these symptoms, these diseases, these health challenges. In your experience treating patients, and I know that every patient is so individual and will have their own unique combination of things going on, but what are kind of like the common culprits? Like, what are the common root causes that are driving this gut imbalance, which then drives all of this chronic disease, illness, symptoms?
Absolutely. And I would say probably for most people, there is a base of a couple that we can start to tackle, and then diving in individually, for sure, everyone is going to have their own individual triggers. So in particular, if we're looking at, and I'm going to say let's talk about like 3 big categories of things that, that are really affecting our guts in general as a population. And the first really is it's the food that we're putting in. So it's everything that touches our gut lining. And in particular, there are some common things that we know contribute to breaking down the tight junctions, the walls in our guts that allow, food particles and bacteria and viruses to get through into our bloodstream. There are some foods that we know also kill good bacteria or help to populate the bad stuff. For example, sugar. So refined sugar, that definitely feeds yeast and it helps to create this base of inflammation. Gluten is actually a big one, and especially here in our country, our gluten is highly sprayed. So it's highly sprayed with glyphosate, and it also contains a concentration of gluten that's about 500 times the norm. So you're getting more gluten in the system. And gluten specifically, if our gut wall it's supposed to be really tight. It's literally one cell layer between your gut and your bloodstream. So literally one cell layer between the sewer and all the poop and your bloodstream. So if that cell layer is broken down, just think of the sewage that's, potentially coming into the system. And gluten in particular breaks that barrier down. A lot of our refined grains, a lot of the processed foods that we eat, there are gums in our food, there are additives and preservatives, all of those things we know contribute. Now, individually for people, and again, this is because food really can be a poison or it can be a medicine, but for each person, there is usually, there could be 2 to 5 to 10 foods specifically that person is eating that's contributing to poor gut health. So for example, when I first checked my food sensitivities, I had things on there that I thought were healthy. So chicken was on there, strawberries were on there. And all that means is that my gut wall had broken down enough that those food particles were getting through, and my body was recognizing that there were floating particles in the system. So it's important for everybody to figure out their own individual food sensitivities. So that's the first thing, would be the foods that we're eating. The second big category, I would say, are all of the environmental toxins. So the things that we may not have quite as much control over, but they're still affecting our system. And again, these are things like glyphosate. So it's important to try to purchase organic food that's not sprayed, to look at the list of the dirty dozen foods. And for those foods, definitely making sure that you're getting organic. Heavy metal toxicity. Sometimes the foods, the water we drink, if we're exposed in our houses to different environmental toxins, mold, things like that, that can also create a base in our guts for inflammation and for the breakdown of the cell wall, as well as the proliferation of the bad bugs. And then I would say the third, and it's not the least important, it might be the most, but it's definitely high up there, is it's our stress levels. So we know that being under stress releases certain chemicals like cortisol, which in the short term are quite valuable for running away from the lion. But over the long term, most of us are living, kind of 24/7 with this cortisol, and it contributes to breaking down our gut wall. And again, allowing the bad bugs to proliferate and the good bugs, to die out. So I think those are like the three main categories people can start looking at. And we definitely have control over what we put into our mouths. The more educated and the more aware we are, the better. And we know that with each bite that we eat, we can ask ourselves, is this contributing to disease or is this contributing to my health? And we can get into, even just some easy ways that people can start implementing this. I always say if you go to the grocery store, if it's in a box or a bag, first off, it has to be questioned. So you want whole foods. You want things that are living, that have just come from the ground. So vegetables, eating the rainbow. You want to put things in your body that are actually going to feed that good gut bacteria, the ones that are creating and producing all of the feel-good hormones and the peptides and the micronutrients. And these are your vegetables. These are your prebiotics, so your fiber, ideally from vegetables. You need to have some protein because you need to have the building blocks for those feel-good hormones. And then you need the healthy fats, which actually help to heal the gut and help to plug in those holes and help to resheath our myelin sheaths of our nerves. So that's one way, is looking, if you pick up a box, you turn it over, if it looks like a chemistry experiment, or there are lots of, words that you can't read, it's probably better to put it back. And really starting with, fresh, whole foods for sure. We can talk about, some different things that help to heal the gut. And then as much as we can, and this is always a little bit nebulous around stress. And it's one of the things we do well at our company is we help people to measure their stress, because a lot of people will say, oh, I'm not stressed, or I don't feel stressed out, or, when it's very profound, they feel it. But otherwise on a daily, basis, they're not feeling the stress. So you can test that. I have a ring on here that, measures my stress levels and looks at things like sleep. So really, first off, being aware that probably there is a base of stress, figuring out what are the things that you can do individually that help to release you in the moment from those stressful situations. It might be breathing techniques. It's actually breathing is great. We take it for granted that we breathe, but when we're in a fight or flight state, most people either hold their breath or they breathe very shallowly. And just deep breathing, signals that vagus nerve, that connection from the gut to the brain, that, okay, we're safe here. We're not running from the lion. So it could be deep breathing. It could be walking in nature for some people. It could be reading a book. It could be dancing. Everybody can find the tools that work for them. And I say, when it comes to stress, when you feel like you're doing everything right, we could find your root cause, we could remove the triggers, we could heal the gut. And if you're still feeling off, that's because there's the stress that is not allowing all those feel-good hormones and everything to work. Kind of puts it in a holding pattern. So I'll stop for a second and see if there are any comments on that, but just a couple ways that people can start.
There's so much. So I just want to make sure that I understand. So it sounds like, again, it's individualized for each person, but really the three main culprits in terms of root causes of poor gut health and all of the issues that stem from that are diet or nutrition, toxins in the environment, and stress. And to deal with those three things, to address those root causes, we need to change the way that we eat. We need to move away from the super processed foods, focus on the outer corners of the grocery store, eating the rainbow, making sure that we're getting the correct balance of macro and micronutrients to heal the gut. For the toxins, trying to be more mindful about what we are putting on and in our body. Like you said, going organic, particularly for the dirty dozen. And then getting our stress under control, whatever that means for us, whether that is deep breathing or dancing. Dancing is a big one for me. I am by no means a good dancer, but I find a ton of joy in it. And it has helped me
Yes.
like manage my stress so much. So, what's interesting to me, there's a couple of things that feel interesting to me in what you said, which is number one, to a certain extent, all three of those things we have some level of control over. And number two, those things are fairly simple and straightforward, but also feel like they could be really hard. Simple, but not easy. So, for people who are listening to this and are feeling stuck, but also overwhelmed by the thought of having to make so many changes to address the root causes of disease, what advice would you give them for just taking those first few steps towards healing and getting unstuck in the process?
Yeah, this is a great question. I'm going to take it from a couple different angles. This is really good because even in our company, sometimes we have patients coming in or they're afraid to start because they think that there are so many changes that are going to need to happen. And one of the things you said, it's taking those first little steps. So literally anyone can start changing their health with the next bite that they put in their mouths. So that's it. It really can start just today. It can start within the next hour. It can start with if you're drinking water. What type of water are you drinking? Did it come out of a plastic bottle? Is it filtered? Just looking at little things like that and knowing that actually these little changes actually they tip the scale in a big way. If I had to say that there was, a couple of things that maybe tip the scale the most, I would say it's removal of what's pounding the system. So this is figuring out what triggers are happening in your gut. What are the foods that you're eating? What is going in your gut that is literally putting your body on fight or flight? It's putting your body into stress, creating the bad bacteria, inhibiting the good gut bacteria. If you can figure that one out, and let's talk about that next, how even individually, without seeing a doctor, how you can start to figure that out. Once you remove what is wrecking the system, the body knows how to heal. And it's always, if we think about our bodies, it's always in one or two states. It's either fight or flight, or it's going to be rest, digest, and heal. If you are eating, it could be one food that's wrecking the system and putting your body in fight or flight. Could be one activity, especially with autoimmunity. Once you figure that out and you just remove that, and it allows the body to sort of exhale. Okay, we're not fighting anymore. And it can actually flip into that rest, digest, and heal. So I would say it is baby steps, but in order of importance, it's figuring out what your root cause is and removing that. We know the body knows how to heal. You get a cut and you immediately see that the body goes to work repairing that cut and replacing the skin and all of that. This is happening on the inside as well, as long as the body is in that state where it is in the optimal place to heal and repair.
So it sounds like these small steps, which reminds me the brilliant Britt Frank, who was a guest on the podcast a few weeks back. She is the expert on all things stuck, and she has this concept called the micro yeses, that when you're feeling stuck, it's not about making these huge sweeping changes. It's about saying these teeny tiny micro yeses towards the behavior that you're going towards. And then those start to string together. You start to feel more motivation. And then those larger changes feel more accessible. So it's great to hear that that's also true for your health. And I'm also hearing that while those micro yeses will help put you in a state of healing, to maximize your healing, it's really about figuring out like what is behind this for my specific body. Is it a food? Is it a specific toxin? Is it I'm chronically stressed and that's keeping my body in fight or flight and preventing it from healing? And that's the key to unlocking like the larger changes in a positive direction in your health. So my question is, how do you do that? Like, how do you figure out? Because it could be so many different things. Like, how do we figure out what is that trigger for me?
Yeah, and this is where I think it's valuable to have someone who is expert at this and get some help. But we'll talk about, what happens before the visit, like what you can do even before the visit. And then I'll chat about, what we do as root cause medicine practitioners to really dive in. So, going back and something you said, the micro yeses, you would be surprised even with just if it's one food that is kind of pounding the system, removing that, how it also helps the trajectory into feeling better and getting unstuck. So sometimes the micro yeses and those little things that you do that you think, oh, I'm just going to remove gluten. I'll just try it for a week and see what happens. The magnitude of the effect that you get, if that is what is creating the stuckness, basically. So I've seen this time and time again with a lot of women who have even brain fog or menopausal symptoms, and they're able to remove, whether it's gluten, it could be dairy for them, it doesn't matter. But as you start to feel better, and it doesn't take weeks. I mean, literally within days, just removing that toxin, whether it's a food toxin or not, and allowing the body to heal and recover creates that boost in energy, and your probiotics come online and they start to basically make more of the feel-good hormones. And that also increases the ability for you to make even more yeses. So I would say initially what you can do, if I had to say there were a few foods to just remove, let's just try it for a week. So it would be, sugar, any sugar and artificial sweeteners, removing gluten or wheat. For some people, eggs. Actually, more and more people seem to have an issue with eggs, dairy, soy, and I would say things like peanuts, because even if peanuts are organic, they tend to carry a toxin. It's called aflatoxin. So even starting there, even if you just remove one, if that thing is part of your ordinary eating. And then I would say, and the second thing for everybody is add more vegetables. And if I gave a quantity, it's hard to say. I always tell people to try to get in like a pound of vegetables a day.
Wow.
But adding vegetables,
a pound
about
of veggies.
A pound of vegetables a day.
Wow. Okay.
Yes. Because vegetables are, first off, they're providing the fiber. They're feeding the good gut bacteria. They're helping to sweep out all of the old hormones, all the old stuff. They also actually pull toxins from the tissues. So especially like for Hashimoto's, if there are antibodies and things stored in the tissue, you want those out. And specifically your leafy green, your cruciferous vegetables, lightly steamed, those are the ones. So add more vegetables. And they're providing the micronutrients that most people who are eating ultra processed food or the South American diet are missing. So that's what you can do. And you can almost do your own diagnostic as far as food sensitivities by going to a very basic eating. Basically, your plate of a base of vegetables, leafy green, organic, cruciferous vegetables, and a side of protein. You can't go wrong. And it's whole foods. You're not getting all of the grains and things like that. So that would be like your diagnostic that you could do to figure out your root cause beforehand. Now, what we do as a company, it's a three-pronged approach, but really that first prong, as far as getting to root causes, is about taking the time to engage with our patients. So our visits are upwards of an hour long. where we really use a detailed questionnaire, which also helps us to hone in on those areas that might be problems. We also use advanced lab work, so a combination of blood work. Our panels are expanded, so even like when we're looking at the thyroid, we're looking at not just the TSH, but we're looking at free T4 and free T3. We're looking at reverse T3, which gives us an idea of whether your hormones are in a holding pattern. And if they are, why are they? Is it because of stress? Is it because of some toxin there? We look at the antibodies. So we're looking at expanded panels, but then we also look at what we call functional panels. Specifically with the gut, it's stool testing. So the stool testing it's a very deep dive into exactly what type of bacteria you have in there. Do you have yeast? Do you have parasites? Like I said, you'd be surprised how many people have parasites that need to be eliminated. We look at digestive enzymes. We're looking at the breakdown of different peptides and things. So we're looking at that, very detailed blood work and functional lab work in order to get to the root cause. And usually with the combination of really learning about your patient and learning what's been happening and about their lifestyle, what exposures they've had, and then looking at that really tailored blood work, you can figure out the root causes pretty quickly.
And I feel like that is something that is so missing from most medical experiences is when I go to the doctor, most of the time, I'm 15 minutes in and out.
Yep. Yep.
We're covering like the very basics of what's going on and then it's on to the next. So really taking a deep dive not only in the appointment but also in the testing to get a much more comprehensive view of what's going on feels like it would be incredibly valuable.
Absolutely. That's why I say test, don't guess. We can guess a little bit, but when we're guessing, we're actually eliminating things that are likely to tip the wheel, initially.
So, toxins were one of the kind of three root culprits for gut health issues, but also feel to me like maybe the biggest question mark and maybe like the ones that we have less control over since they're environmental. So, what is the process? I guess this is a two-part question. Like, one, if you have a toxic buildup of glyphosate, aflatoxin, whatever toxins they may be, is it possible to rid the body of those toxins completely? And how do you do that outside of, or maybe it is just nutrition or supplements, or like, what is that process for just getting those toxins out of the body?
Yeah, it's a great question. And again, sometimes you can figure out the toxins just by talking with someone. So, you can gauge based on the age of your home or the area of the country you're living in, whether you might be exposed to certain things. Do you live by a farm? Do you see the crop duster coming by?
Mm-hmm.
And if you're eating non-organic, you likely have glyphosate. So we know that there is a certain burden that most people have. So again, taking the time to learn about your patient is number one. Second, it's test, don't guess. So we can actually, there's functional testing that looks at toxins from mold to mercury to other heavy metals to glyphosate. And not just do you have it, but the level that you have it in. And these are important, especially things like mold. Sometimes people suffer for years with not even having a diagnosis, but they feel horrible. But mold has encroached in their body and created this inflammation. And then, absolutely. So, like I said, if you weren't born with it, it can heal. And the same way, that we get disease is I say it's food as medicine first and foremost. So I love the leafy green and cruciferous vegetables. They are kind of the powerhouses. The colorful vegetables contain things called polyphenols. All of these help to draw toxins out of the body. Interestingly, herbs, things like cilantro,
Ooh, yum.
yes, yeah, help to pull toxins from the body. And depending on what the toxin is, absolutely, there are supplements as well that can do that. But most of the supplements, interestingly, are combinations of nutrients and minerals, herbals like cilantro, things that we can get in our food, but we would give it in a higher dose. And absolutely, these help to rid the body. And then we have to make sure too, since we're talking about the gut, that we are eliminating every day, because anything that you put in even if you're pulling out toxins, you want to make sure it's leaving the body. So it's very, very important. Most people who come who don't have diarrhea actually have functional constipation. So they are not having a bowel movement every day, or it's a couple times a week. And oh, yeah, that's normal for me. But actually, if we think about babies and animals, they eat and then they eliminate. They eat and, what was there before comes out. So it's really important to have healthy elimination. And yeah, I think when we're talking about gut health, when we're talking about everything, we have to make sure also that those elimination pathways via bowel movements and urination, sweating, that those things are also utilized to make sure that we get rid of those toxins. But it's a great question. Yeah. The other thing I wanted to mention about that, because I hear you when you say it feels like that one might be a little less out of our control. One of the things we can start to look at, though, is even, our drinking, our sources of water, the things that we put on our skin for women, the makeup, the creams, the things like that. So really using organic, natural products or things with just essential oils, maybe with a little glycerin or something like that. There are some great companies out there who are really passionate about making sure that the products are pure, I'll say, in a sense. So those are some ways that we can take control in that sense with controlling the toxin burden.
I am loving like the clean beauty trend. I feel like more and more when you go to a Sephora or an Ulta, there are more and more brands that are certifying their products as clean and organic and removing
Yes.
all of those harmful chemicals, which hopefully is a trend that continues with all, similar with household products. You can go on certain websites and get really natural but effective home products. So hopefully that trend continues.
Yep, that's a good point too with the house products, all of that. Yeah.
Okay, so it sounds like the process. I'm going to lay it out from beginning to end. I am feeling stuck. I'm anxious. I'm depressed. I have some sort of chronic disease. I'm having all of these symptoms. I'm bloated. I'm constipated, whatever the case may be. I need to discover what the root cause of that is. That is the key to unlocking better gut health and, as such, better overall health. Then we are going to make changes to our nutrition, our exposure to environmental toxins, and getting a better handle on stress. All of those changes will then heal the challenges that are going on in the gut, restore a healthy gut balance, and help to not only minimize or ideally eliminate the symptoms, but actually get rid of the root of what is causing the symptoms so they're not going to come back.
Absolutely. And it's utterly important because if you do not get to the root cause of whatever issue is happening in the gut or mentally or autoimmunity, unfortunately, because our bodies are, we have one body. This is what happens year after year when a new disease or a new diagnosis crops up. So this is why it's so important to get to the root cause, because what the root cause for one issue is the root cause for all of them. Yeah.
And it also sounds like from what you said that there are absolutely changes that we can make as individuals. And there's a ton of information out there on how to heal. But if we can work with a medical team to handle these changes, it would be helpful. But we also spoke about how finding the right doctor and team can be challenging, particularly in traditional medicine. So if someone is listening and says, hey, I really want to work with someone to start healing this and feeling better, what advice do you have for them on how to find the right doctor for taking them on this journey from stuck to unstuck in terms of their gut health?
Sure. Well, they can come to Ciba if they like. So I think it's really important to work with someone who is trained in this root cause approach. And again, this is one of the things that it's been my vision to make sure that more people can have access to this kind of medicine. This is what I went into medical school, and this is what I did this for. So yeah, I think it's utterly important to find someone who is not only trained in this type of root cause approach, but who is really passionate about you as a patient and really looking at you as a whole person. So you have to look at everybody in a holistic way, really listening to, most of the time, honestly, even before we do all of the advanced testing. If you take the time to really hear what your patient is saying and what exposures they have, what their lifestyle challenges are, and you can't do that in 10 or 15 minutes. So if you take the time, you can narrow down quite deeply, even just with a conversation and getting to know someone. And then the testing, again, it's test, don't guess. So that really helps to hone and narrow it in. And once you find that, you remove those triggers, like I said. And we didn't talk as much about like the healing of the gut, because again, the body does a lot of it, but there are things that we can do even on a daily basis. We did talk about getting fiber and vegetables, but things like omega-3s, zinc, like actually having a really good quality multivitamin. These are things that don't seem like they would tip the wheel, but they actually do help to repair. And then having a team, it's one of the things at Ciba Health that we pride ourselves on is making sure that the patient also has a team to support them through the journey. Like you said, sometimes it can seem daunting, like, oh my gosh, I have all these changes to make, or oh my goodness, this one food that is my absolute favorite food is what is creating the issue. So it helps to have a team around you to not only support you, but to offer solutions. So we would never tell someone to, if pizza is your absolute favorite thing and gluten and dairy are on your list of you cannot have that or it is going to pound the system. Well, guess what? We have registered dietitians who will work with you. We can actually do something called swaps. So, like dairy is something that for me, it's going to create some problems with inflammation. But guess what? My food sensitivity says I can do a little sheep dairy or I can do some vegan dairy options. And maybe your crust can be a cauliflower based crust. So it's working with the patient, with their lifestyle, what they need. How about your family? How about your kids? What do they want to eat as well? And likely, you're not going to be able to make big changes for one person in a family without really considering everyone else. So you really need that team approach. We also have health coaches as well who, are in your corner, who answer questions, who help you figure out what are your whys and what are your goals and help to remind you as you go through. Because sometimes things will get tough. I will say for anyone with a health challenge, 99+% of people, okay, basically everybody, has to make some change in their lifestyle, whether it's the food, a type of food they're eating, an environment, exposure, something like that. So it really helps to have the support. We're not here alone on this planet, so we don't have to do it alone. And it helps to have a team who's really behind you and supporting your goals. This isn't the doctor says do this, so go and take your prescription. It's what do you want? You are the one who's with your body 24/7, 365. And honestly, the portion of time you spend in the visit is very small compared to what happens when you go out in life. So we need to take that into account and make sure that the plan is going to work for you and it's going to work for your life.
That was the one thing that I was so taken by with Ciba Health was the immense types and amount of support that you offer. It's not just a doctor, it's not just testing. It's every aspect that you could need help with, whether that's creating a meal plan or sticking to your health goals or identifying what the challenge is. It's like you've got something for everybody, no matter what they need.
We do. Plus, we add the tools for the empowerment. So it doesn't help just to tell someone you need to sleep better, you need to get better sleep without providing a tool to measure your sleep and have people be able to look at that data and look at the changes that they're making and really see how, oh, okay, I didn't have my nightly wine and I slept this way. And I had coffee this day and I slept this way. So it's able to provide that feedback specifically for our participants for sleep and for stress. And, we use a continuous glucose monitor when we're reversing diabetes. So we do like to use the data for not just for the providers, but also more importantly for all of the clients that we work with. It's one other way to help that trajectory for the many yeses and is seeing that what you're doing is actually making a difference.
I just love this approach so much.
Me too.
One additional question, and this is my type A personality is coming out in full force right now. But in your experience, if someone is making these changes, is figuring out the root cause and then addressing it, like, what does the healing journey look like? Like, how long does it take to heal the gut?
Ooh, that's a tricky.
I
Yeah,
know. It's like, I just want you to give me like a calendar. Like, you can expect to feel better on July 31st.
yeah, it is tricky. It depends a little bit on, I would say, how much damage has been done. So, how much work the body needs to do that repair. And if we're saying that the participant is 100% following the plan, that's what we're assuming,
Full
then
compliance.
it can be very fast. So normally I'll take, for example, someone with even diabetes. And the reason I'm saying diabetes is because we can very clearly see when the shift happens into what we call metabolic flexibility. That can take 2 weeks up to several
Wow.
months. And then for the gut, remember, once you remove that inciting factor and you put the healing components in, the body goes right to work immediately. If we look at a cut, we can see how quickly that cut heals. The same thing is happening in our digestive tract. So, in a perfect system, it doesn't take long at all. Each person is different because everybody has their own set of circumstances, what they're eating, what the stress level in particular. Our programs at Ciba Health are for a 1 year program. And usually the way we break that down is the first 6 months is quite intensive. We expect to have reversal within that 6 months. And then the second 6 months is usually about maintenance and stabilization and making sure that the kind of the plan for life. You know your triggers, you know how to course correct. So I would say within that period, we can get good reversal. Now, if it's, someone who has, let's just say, MS, or they have significant damage, let's say, to the nervous system or the nerves or the myelin sheath, there is a certain time frame that like nerves regenerate. So that could take a little bit longer. But regardless of how long it takes, you will notice a difference almost immediately when you figure out your root, you remove it, you start plugging in those gaps, you address the stress. That doesn't take long. And that's what helps you to continue the journey until the healing is complete.
Oh, that is like, you are flooding my system with optimism right now. So thank you. Dr. Nichols, this has been a mind blowing conversation. I feel like there are so many gears kind of turning in my head. So thank you for all of
Oh,
those incredible
absolutely.
insights. Here at Season of Stuck, as we approach the end of the interview, there's just a couple of questions that we like to jump into. So if it's okay with you, I just have a few more questions.
Okay.
Okay. So, first question, thinking about the future version of yourself, like the ideal version that you're working every day to grow into. If she could travel back in time and talk to the current version of you, what advice do you think she would give you on how to navigate stuckness at this point of your life?
My future self would definitely tell me to have more fun. And I think what that means for me is like one of the things I like to have people do actually is create a joy list. It's like, that list of 10 things that really don't involve anybody else, but that you could pick any of those and it's going to break you free in the moment. So she would say, make sure you're following your joy list and you're doing something on that list every day, whether it's dancing. For me, you said dancing was like, that's definitely my thing as well, and being out in nature. So it would be to have just enjoy life more.
I love that. A joy list. For me, for sure, top three: dogs, dancing, nature.
Oh,
100%.
love it. We're like right there.
Yep. Okay, so the next questions are lightning round. So I am just going to ask a question and you say the first thing that comes to your mind.
Oh.
Okay. Favorite movie of all time?
I'm going to say Avatar, but
Ooh.
you could give me any movie that has a combination of sci-fi, fantasy, adventure, romance. Like if it has it all, I'm there.
You like an epic
I
film.
do. Yeah.
What did you think about the Avatar sequel?
I haven't seen that one actually yet.
Ooh, okay. Well, I've heard that it's epic. I also didn't see it, but
Yeah, I'm a little afraid to watch it, but I need to.
okay. Go to coffee order.
When I have coffee, I would say it would be a coconut milk latte.
I love coconut milk. I've never had it in a latte though, so that is a good tip. I might try that.
And I would say it ideally with functional coffee. Like I use, it's called Four Sigmatic. It has some lion's mane and reishi. So probably, once or twice a week. That's what I would go to.
And those are all like kind of adaptogens, functional
Absolutely.
mushrooms.
Oh,
Do
yeah.
those support the health of the gut?
Yes, they do.
Good to know.
And the brain.
And the brain. So gut
Yes.
and brain with the connection.
Yes.
If you could have any animal in the world as a pet, what animal would you have?
Oh, I love my current fur baby.
That's my answer too. I love when people say that. I was like, you could give me a lion, a tiger, an elephant, and no, I just want my two little dogs.
Yes.
And then last question, what is the best concert that you've ever been to?
Give me a good, symphony orchestra,
Mm.
with classical music.
Mm-hmm. That's such a, particularly live, such a moving, immersive experience to hear.
That's why I love it.
Mm-hmm.
Yeah, it's like you feel it all through your body. Yes.
Here, I live about an hour outside of Portland, Oregon, and the Oregon Symphony, they do movie showings with a live orchestra that plays the scores while they show the movie. And it's my favorite thing in the world.
I love movie scores.
Mm-hmm.
Yes.
Again, Dr. Nichols, thank you so much for being here. This was such an incredibly helpful conversation to me. And I know that people listening who are struggling with their gut health will also feel so empowered and hopeful and optimistic. So thank you for that. If anyone listening wants to connect with you or learn more about Ciba Health and the services that you offer, how can they do that?
Yeah, they can come right to our website, which is www.cibahealth.com. And they can definitely learn about us, or they can schedule a call to meet with one of our care advisors to talk more about what we do. And I really appreciate you having me here. So this is an important conversation, I think, not just about the gut, but about root cause medicine and about the stuckness. It's a very important conversation to have. So I am honored to be here, sharing anything to really help people to know that there is a potential for something different to occur.
And I am honored having you here. So thank you again. Again, so powerful. So appreciate you being here.
Absolutely.
That's it for today. A huge thank you to our guests for their incredible insights, and a huge thank you to you, our listeners. We know that there are so many podcasts out there to choose from, and we are just so grateful that you chose ours. If you enjoyed today's episode, consider recommending the podcast to a friend or family member that you think would enjoy it. And to make sure that you never miss an episode, subscribe on Apple Podcasts, Spotify, or wherever it is you get your podcasts. And while you're there, if you loved the show, please consider leaving a 5-star review. It plays such a huge part in getting this podcast out to a wider audience and ultimately supporting more people on their journey from stuck to unstuck. And to keep in touch and access even more stuck-related content, follow us on Instagram @SeasonOfStuck and visit our website, seasonofstuck.com, where you can sign up to get episodes delivered directly to your inbox. Thank you again for being here. It is so appreciated. Until next time, I'm Deanna deBara, and you're listening to Season of Stuck.